Ever since I was about 8 or 9 years old, I'd known something was not quite right with me mentally. But speaking to anyone, let alone doing anything about it, was tough. As a teenager, I believed that I'll die young. I wanted to die young. Dying to me was better than living with emotions that were like a swing set, up and down, never quite still, tormented by some ill wind. I believed I had somehow broken my brain.
Hello, you're welcome to another episode of The Heart of the Matter. Today we're talking about a subject which I think we ought to talk a lot more about. It's the subject of mental illness. And with me for today's program is Dr. Gbonju Abiri. You're welcome to The Heart of the Matter.
Thank you, sir.
Now, talking about mental illness, the average Nigerian equates mental illness with madness. If somebody is mentally ill, they're mad. Could you tell us what mental illness is and what it isn't?
All right. Well, first, we always like to start by saying there is no health without mental health. And then I'd like to define health by the World Health Organization definition, which says health is not just the absence of disease or infirmity, but a complete state of mental, social, and emotional as well as spiritual well-being. Okay. But mental illness would actually, of course, mean there's a problem with the brain. But it also means that there's a problem with successfully performing functions in terms of emotion, behavior, feelings, as well as other aspects of people's perceptions. So when there's a problem with any of those areas, emotions, behavior, perception, and other aspects of living and being, we say there is a mental illness.
Okay, I want to take you up on a little bit of what you said. You said that it's all a function of the brain. So if somebody's behavior, if somebody's social interactions are affected, we can trace it back to the brain.
Yes, the brain is, it's like the engine room of the body. Of course, a cardiologist will tell you the heart is the engine room of the body. But we always say, there's a Yoruba saying that says that if there's anything wrong with the body, it starts with the head. So in psychiatry or in neuropsychiatry, what we look at is how the brain works and how the brain affects and effects its functions on other organs of the body.
Okay, so now when we talk about mental health in Nigeria, now you actually are a medical doctor, a psychiatrist, and you work at what a lot of people have commonly begun to call Yaba left.
Yes.
Okay, and when the name Yaba left is mentioned, what arises in people's mind is captivity, and so on and so forth. What would you like the public to understand that mental health isn't?
All right, well, it's amazing that it's 2012, and like you rightly said when you started, when people hear mental illness, they say mad. Yeah. And, you know, when people say that, I say no, don't say so, because the people or the persons you're talking about are people's relatives, people's loved ones, husbands, fathers, sons, maybe even wives. Mental illness is an illness like every other illness. That's what we have come to realize and discover. And over time, we've also come to find out that it's not just sometimes the brain that has a problem. Sometimes you can actually have a physical illness, which a regular medical doctor would see that would finally come down. So it's about time people realize that mental illness or mentally ill people have to be treated and thought about and taken seriously, yes, like the rest of us, because they do have a chance at life and they can actually live functional lives.
When I was in the university, I used to go to the guidance counseling department regularly. It helped, but it wasn't professional help in the real sense of it. It was just a way of coping without dealing actively with what I was going through. By 22, I had my LLB and BL while I was still in law school. I got recruited into the company I dreamed of working. I was good at my job, rewriting and copy editing, and within 18 months, I'd moved on to better prospects twice. To everyone around me, I was doing good, but to myself, I wasn't. I'd always felt like I wasn't good enough, like I could never be good enough. My personal relationships were a mess. I didn't like people. I kept away from them. as much as possible. The ones I let in constantly had to deal with my moods. I was good at putting on a smile and what I called my normal face. I was good at holding the turmoil in for whatever number of hours I needed to. What no one knew was that I was dying inside.
Okay, can it be cured, mental illness?
Well, it's a tough question to answer. And it's a tough question to either give you a yes or a no. Mental illness, like many physical illnesses, can be managed. You'd find it surprising that people actually come to the hospital and they tell you, my hypertension has gone, or my diabetes has gone. Illnesses sometimes don't go. Of course, I am looking at it from the medical point of view, not spiritually now. Mental illness can be managed, but we don't like to tell a lot of our patients that it can be cured, because it just means we're giving a lot of them false hope.
Okay, now, what are the typical causes of mental illness? I know this is a big question because there are many different types of mental illness, but what are the typical causes of mental illness?
Well, if I was to look at the cause, I would first of all look at the age ranges they affect. You'd see mental illnesses in children, you see mental illnesses in adults. It's in the old, it's in the young, it's in the rich, it's in the poor. It's no respect of persons. But overall, causes of mental illnesses would range from, for instance, if I was looking at a child, you'd look at when the mother, before she got pregnant, did she even have a mental illness on her own? When she did get pregnant, what kind of care did she get? Did she go for antenatal care? Was she taking herbs in pregnancy which could have affected the development of the child? Was she taking substances, for instance, alcohol, opioids, cannabis, just to mention a few? Then when the child is actually growing in the mother's womb, did he have any chromosomal abnormalities? Some children are actually born and they have conditions like Down syndrome. Or at the time of delivery, did he suffer, was it a prolonged delivery such that the baby did not cry at birth and had to be put in an incubator for quite a while? That's as much as it is for children. But when you look at an adult, there is everything ranging from trauma to the head, or to other parts of the body. For instance, if someone has an amputation of a particular part of the body, it can actually result finally in a mental illness. To infections such as maybe a meningitis. You could have tumors in the brain, or tumors in any other part of the body, which can eventually metastasize to other parts of the body. And then you have things like heavy metal poisoning. In Nigeria nowadays, we hear about lead poisoning somewhere in the north. So all of these things and many more can actually cause mental illnesses.
Okay. What about traumatic events like abuse? Some children might have been abused by parents, rape, robberies, violent robberies. Can these eventually lead to mental illness?
You'd find it rather surprising to find out that people who have been abused become abusers.
Okay.
It's called the compulsion to repeat. And yes, things as simple as too large a family size, inconsistent parenting, one parent says this, another parent says another, being raised in overcrowded neighborhoods, and like you just mentioned, being raped, and then abuse in children ranges from physical, emotional, sexual, to even neglect, not giving a child what a child needs as at the time the child wants. And then of course, focus on Nigeria right now would be incomplete if we don't speak about terrorism, kidnappings, because all of those things will not just cause adjustment disorders, they could also go on to cause acute stress disorders, or what everybody largely knows as the post-traumatic stress disorder. So it's not just wars and such traumatic events that can actually cause those things. All of the things that we have, the plane crashes, the bombings, the floods, just to mention a few, can actually result in mental illness.
Okay. Now, most people think of somebody who is mental as someone who takes off his clothes, has dreadlocks hair, and is roaming the streets eating from bins. But is that necessarily the case?
No, that's an extreme. And I was speaking with a patient 2 days ago, and she said, there's nothing wrong with me. Why did they bring me here? And I said, you have deviated from what is seen as the norm. You take a whole chicken and you put it in the pot without cutting. and you say you want to cook. There are actually people who have mental illnesses and function well at their jobs. There are people who have mental illnesses and are able to, you know, carry on with their duties. They can carry on as mother, as wife, and all of that. So it's not until a man is raving mad, like people would say, or stark naked and running up and down the roads that is mentally imbalanced.
Okay. Like every other illness, isn't it the same with mental illness, that the quicker you treat the person, the better the chance of recovery? So what would you say, or how do you diagnose for somebody who's living with somebody who's got a mental problem? How would you diagnose that the person has a mental problem?
Okay, well, the first time we see patients, it's because probably relatives have noticed that they're doing odd things that they never used to do before. So like I mentioned a little earlier, there's a deviation from the norm.
Okay.
Then the behavior is becoming worrisome and troublesome. And then patients start to have experiences that they never used to have before. For instance, they start to hear voices of people that other people cannot see, and then even they cannot see. They start to see strange things that other people can't see. They start to have strange experiences, like feeling as if I'm here and I feel everywhere around is a graveyard, like everyone is unreal, or that even I am unreal. And then, of course, you look at things like they lose appetite, they can't have healthy interactions with people that they once had. And of course, there's disability in a lot of their lives. There is social disability as well as occupational disability. So when some of these things, because not everybody will come down with a barrage of all these things, but when you start to notice subtle signs, it's time to take action.
Okay. Well, we're going to come back and continue this subject. Viewers, we're going to take a quick break. We'll be back in a moment, so stay tuned. Welcome back to the Heart of the Matter, where we're talking about mental illness. Our guest today is Dr. Gbonju Abiri, and she's a psychiatrist. And just before we went on a break, you told us how we could recognize mental illness, that somebody's behavior may vary from the norm, and so on and so forth. Now, what happens when we recognize that somebody is not behaving normally? What do we do?
Well, what we should do is bring them to the hospital, or at least get an expert opinion, speak to a doctor, and then the doctor, if he recognizes the signs, would ask that you see a psychiatrist, which is part of what we're working on. A lot of doctors in primary care settings, which is smaller hospitals and even general hospitals, cannot recognize the signs of mental illness. Patients can come down with complaints such as, oh, I feel something walking on my skin, or I feel something crawling on my head, or I feel my head increase in size. But if you go to a psychiatrist, is most likely able to see that as a pointer of something else going on. So it's important that when people see these subtle signs, you seek expert care, or you walk to the psychiatric hospital, which is at Yaba, like you rightly said.
One day, after bouts of anxiety attacks, depression, and rage, I went to the Yaba Neuro-Psychiatric Hospital, where I was diagnosed with recurrent depression. They gave me drugs, but after a while, the panic and depression came back. A psychiatric friend referred me to another doctor at the hospital, and she and a few other doctors diagnosed me with borderline personality disorder, BPD. They put me on new drugs and told me that alongside cognitive behavioral therapy, that I'll be fine.
Okay, now, here's the problem. A lot of people associate a psychiatric hospital with this madness. So how can people be encouraged to go to psychiatric hospitals? Is there, I am an adult, but if I was driving my car into Yaba left, as they call it, I would wonder, is anybody watching me going in? Do they think I've gone mad? And so how can we help to disabuse people's minds from this immediate impression that anybody who goes to Yaba is on their way to lunacy?
All right. Well, first of all, part of what we should do is let people realize that over time, and even in everything around us, Nigerians and a lot of Africans have ingrained in them culture and religion. A lot of us tie culture and religion to too many things. So you find out that people who have mental illnesses are not brought to the hospital. In fact, the hospital is seen as a last resort. They take them to churches or herbal homes where they are tied down and beaten. You'd be surprised, all sorts of maltreatments that patients are put under. So the truth is, getting the word out there is by speaking about it. It's by word of mouth. When I see people who have epilepsy or what people will call convulsions, which have become chronic over time, and I say, is your relative getting better? They say yes. And then I ask, if you saw someone else with this kind of condition, would you tell them to get help here? Because in the end, it would mean that you also got help here. Some of them are hesitant, of course, but some of them are willing to say, come on, I got help here, so why can't I tell anyone else? So we're looking at a lot of advocacy, a lot of education on both print and electronic media so that people can get the word out there. Mental illness can be managed.
I checked out the symptoms of BPD on the internet, and I was so scared by how similar these symptoms were to the character traits I had exhibited all my life. In a moment of depression, the next morning I tried to kill myself by overdosing on pills. I was taken to the emergency unit and spent the next 5 days in the psych ward.
Now let's talk about some of the reasons that psychiatric hospitals actually have to confine some of their patients. Some patients, I guess, have disorders or illnesses that make them a threat to members of the society or even to themselves. So what kind of illnesses are these, and how can the members of the public realize, and so on?
Okay, well, first of all, I should clear the air. There's this misrepresentation that a mentally ill person is almost always aggressive. That's not true. In fact, if anything, they're attacked more than they being the attackers. So what should be done actually is the fact that, well, they bring them to the hospital because they have become a threat to sometimes themselves and to people around them. And of course, you see such in conditions such as deliberate self-harm, which would come under suicide. A person who has deliberate self-harm hurts themselves, they slash their wrists. A lot of them are found and they're brought to the hospital, or they take pills in a bid to just end their lives, or they just do something traumatic to their own selves. But you also see people who commit suicide outrightly. By the time someone commits suicide outrightly, suicide is self-inflicted and intentional harm that always results in a fatal outcome. So you probably won't see that extreme of a patient who commits suicide. But even in conditions such as schizophrenia or depression, you'd be surprised that even people who are depressed and are supposed to be sad and probably calm are irritable and can be a danger to themselves or to the environment. At that point, we bring them in. Okay,
now you brought up the subject of suicide. Now, so you're saying that somebody that is suicidal has mental health problems?
Yes. It's been found that in about 80 to 90% of people who actually go on to commit suicide and die, that a lot of them actually had unidentified mental illnesses. People, how we just hope against all odds that there's nothing wrong with them. So in a lot of them, you actually find unidentified or probably, if identified, neglected and denied to a large extent mental illness.
Okay, so now could this mental illness have been a result of their environment, where certain things have happened, they've entered into depression and so on, or is this something has gone wrong in the brain?
All right, well, we like to look at psychiatry as a mix between nature and nurture. Nature because, for instance, some mental illnesses are hereditary. So the fact that a mother has it increases the likelihood that a child would have it. But then when you now have someone who has an underlying mental illness, which we call a predisposition, and you have an environmental factor acting on it, you can imagine, okay, so a mother has a bipolar affective disorder, which is a mix between mania and depression, and then passes it on, or at least the child takes it on. And then as the child gets to about his teens, he's with his friends, and because he has low self-esteem, maybe because of the illness, or he's trying to belong, he decides to experiment with alcohol, cigarettes, and then he starts to build it up to cannabis, cocaine, heroin, just to mention a few. All of those things, it's an interplay of many things. We can't just a lot of times say that it's one factor that has led to the mental illness.
Okay, can I bust a myth? You know, if you would help me, is it true that smoking cannabis turns you mad?
It's a controversial topic because you actually see a lot of people smoking cannabis and there's nothing wrong with them. They're able to function. Yesterday I drove past somewhere and I saw two young men sitting on the trunk of a car and they were smoking and they were talking to each other. But the truth is, it increases the chances of coming down with a form of psychosis, and specifically schizophrenia. It's been found that if we're able to reduce the amount of people who actually smoke cannabis, we can, to a large extent, reduce the people that will come down with schizophrenia. So it's a bi-directional thing. People with schizophrenia sometimes self-medicate. You know, they hear voices of people they can't see, and by the time they take cannabis, all the voices go away. Or you find people who actually take cannabis and then come down with psychosis, and then of course the extreme would be a schizophrenic illness.
Now, if you had a magic wand and you were able to wave it and everything about mental health delivery, mental health care delivery in Nigeria could change, what would you want to see in our mental health care delivery system?
I'd like to see a lot. And the lot would start from the government. It would surprise you to know that the mental health bill has not been passed. In fact, they still refer to them as lunatics. We're still using.
So what does the mental health bill change? That
Well, for instance, it restricts our treatment of patients. For instance, you can see a patient on the street and it limits you from actually going ahead to bring them to where they will need help. It limits the fact that you can actually do a compulsory detention of patients because you have old forms that are now obsolete. In places like in the UK, they have the Mental Health Act. And then, of course, I would want that relatives and carers of people who live with mental health and even people in the environment treat them like human beings. We should destigmatize mental illness. We should, like in 2001, WHO theme was stop exclusion, dare to care. Okay. So it's about time, I think, that we change our attitude towards people with mental illnesses.
Okay, so that's what you would wish for?
Yes.
What about changing the face of the hospitals? I mean, the two most common ones in this part of Nigeria are your facility in Yaba and the facility in Abeokuta. And they both have a stigma attached to them. So that, you know, anybody that goes to those hospitals is seen as being a lunatic. Okay, and we know that that is far from the case. As a matter of fact, from my own little research, almost at least 50% of the society in the developed countries visit but not necessarily a psychiatrist, but a psychoanalyst frequently, just as part of their normal life. People suffer from stress, work-related stress, and they need to be able to talk to somebody about it. So wouldn't you like to see people-friendly psychiatric hospitals?
Well, I always invite people to come to the hospital to see me. And then when they come in, they're like, so this place is this calm and this beautiful. You'd be surprised, Aro too is a beautiful place. Yaba too is a very beautiful place. And over time, people are getting destigmatized. People actually walking on their own. And they come talk to you about conditions such as phobias, or obsessions and compulsions that they have. So, people are they're not being forced in anymore by relatives who tie them down in shackles and in bonds. They actually come themselves. And of course, the services are friendly. They're becoming more friendly by the day. There are people you can talk to. That if you don't want to come to the hospital directly, there are, of course, people that you can always reach and talk to. That, okay, I'd like to come to the hospital. What can I do? What should I do? Who should I see? The hospital is actually a very friendly place. But like you said, it's education, and more education. People have to hear it and then hear it from other people too who have been helped.
Since I left the hospital, I've been getting better steadily. Prescription drugs and consciousness of what triggers moods and episodes has helped me in my recovery. I do my best to avoid these triggers. When I feel the tiniest bit of panic, rage, or sadness coming on, I ask myself, is this a normal reaction or one born from BPD? Another source of help for me is reading about other people who are overcoming various mental illnesses. Their lives serve as an inspiration for me. I have no shame about having a mental illness. I repeatedly tell myself that I am a normal person overcoming BPD. I see needing drugs and therapy to live better as something like needing glasses to see better.
Now, what can be done about the stigmas that have attached to hospitals?
Well, stigma can be broken, in my own words, by advocacy and educating the populace. There can never be so much of education. Education in the print media, education in the electronic media, and very importantly, education by people who have received help and have gotten better and have returned to full functioning. That would be it.
Thank you. I wish we could go on because there's so much to talk about, but we have a limited amount of time. Is there one last thing you would like to say to the viewers about mental illness before we break?
Well, I'd like the viewers to know there is no health without mental health. Just because you're not overtly on the road, naked, or with dreads on your head doesn't mean that you're ill. If you have sleep problems, we see things as little as sleep problems to epilepsy. We see children with Down syndrome, children with autism. We see a whole range of things. The services are available and they are friendly. It's important that you come in when you can, and it's important that you seek help early because presenting late actually complicates the condition. Thank you.
Thank you very much. I just want to get this one in. Do you get a lot of people that blame their problem on juju?
This is Africa, and specifically so Nigeria. Yes, people say my mom's brother's auntie is responsible for my issues. Of course, sometimes it's part of the psychopathology of their illnesses. But because we have culture, like I mentioned, and religion ingrained in all of our beliefs, a lot of people look back and say, no, there's nothing wrong with me. There must have been somebody somewhere cooking something and making sure that all of this happened to them.
Dr. Abiri, it's been great to have you on the Heart of the Matter. And, viewers, if you do need to get in touch with her, contact details will be flashed across the screen. Thanks ever so much for coming.
Thank you, sir.
Viewers, we'll be back again next week with another episode. Until then, stay blessed.
The first step in overcoming is acceptance and willingness to get better. There is a need to stop shrouding mental illness in secrecy. It's better to just face it, get professional help, and deal with it.